breaking news and what is going on with the COVID-19 virus. I just want to let you know that Vashi will no longer be participating, but we're very lucky to have Rachel Curran, who will be moderating the armchair discussion. And I also want to thank each of you in the room today for being present. The Economic Club is certainly taking measures to ensure that everyone's safety is a top priority. And, we're in this together. So thank you for being here. Let's just get innovative and creative on how we interact with one another. I know we had a couple jokes earlier about trying to do the elbow thing or doing the leg thing or doing a little tap dance. So now's the time for, I was speaking with Pamela earlier, collective innovation. So let's do this together and remain safe. So for those of you who don't know me, my name is Natasha Morano, and I am the Managing Director of the Economic Club here in Ottawa. It's wonderful to see so many familiar faces in the audience and a full room. This is wonderful, so thank you. I would like to begin by acknowledging that the land on which we gather is the traditional unceded Algonquin territory. We at the Economic Club begin every event by extending our respect to First Nations, Inuit, and Métis people for their valuable past and present contributions to this country and stewardship of this land. We are grateful to be here this morning, actually this afternoon now, to host the Honourable Peter Bethlenfalvy, President of the Treasury Board of Ontario. Today, Minister Bethlenfalvy will discuss the changing culture of government and how Ontario is fundamentally improving user experience. And, given what's going on right now with the COVID-19, this is a perfect case study on how we can digitalize the future. I'd also like to thank the handful of elected government officials that are here in the room and the ministers that carved time out of their day to be here. So thank you so very much for being here. We really do appreciate it. I would also like to thank our event sponsor for today's session, Innovative Medicines Canada. Thank you, Pamela, for all of your support. We do appreciate it. I would also like to thank our event partner, Santa's Health. So please join me in giving them a round of applause. Now we've got to keep humor alive during these times. So I was joking earlier. I said, trying to get creative with marketing strategy. So we should have had hand sanitizers on each table with Innovative Medicines Canada logo or Santa's Health logo on the table. But exercise your hand sanitization. I'd also like to thank our annual partners, who we simply could not do these events without. They really are the backbone of the Economic Club of Canada. So a big thank you to Green Shield, CPA Ontario, Best Life Rewarded, the Canadian Bankers Association, Capital One, Interact, PwC, Porter Airlines, LHH Knightsbridge, and Vocal Meat. Now, the Economic Club of Canada is this country's national podium of record, and annually we host close to 100 events right across the country. And our goal is to bring Canadians together to talk about the most important pressing issues of the day. So this event is very apropos. Now, we are a club for all Canadians, and we have a mandate to include youth in our discussions. And through the work that we do via the Junior Economic Club of Canada, we have engaged over 60,000 youth from right across the country. This is something that I am extremely proud of. We are also proud that we are an all-female Economic Club team. And as celebrations continue this week for International Women's Day, I'd like to take the time to applaud the incredible women that I work with every day at the Economic Club of Canada. It's an absolute pleasure. We have Morgan and Julia here today supporting this event, so thank you. It now gives me great pleasure to turn the podium over to Mr. Cam Vidler, Public Sector Lead at Green Shield Canada, who will officially get things started. Welcome to the podium, Cam. Now, should we do the foot or the arm or the...
Thanks so much, Natasha. So I'll keep this very short, but we're very honored to support this event today. And me personally to have the privilege of introducing Minister Bethlenfalvy. I think I just want to start with a big thank you, and Natasha said it as well, but to our public servants, and we're privileged to have a lot of representatives from the Ontario Cabinet here. The last few days have been very busy ones, very stressful ones, and I think if we can all maybe give a round of applause just to you for the work that you're doing, reassuring Ontarians that everything's going to be okay. Now, this is obviously very near to us as a company as well. If you're not familiar with us, we do group health and dental benefits. We have over 1 million Ontarians that look to us for their medications, their drugs, their health services. And so, we really do understand the importance of making sure that people are taking the right precautions, and that they can really be confident that the services they need from government, from their other medical services providers, are there for them. And so we've really offered our assistance to the Government of Ontario, but also governments across the country. However we can help, whether it's with our data, with our expertise, we're there for you. Now, the crisis focuses our attention, I think, on the role of government, and really reminds us why we do need to look to government, why it's really important to have that backstop. But I think I would just want to say that we need to also, leave this moment and this crisis with the same kind of spirit, looking at the way in which we deliver public services more generally. The work that Minister is doing on improving the user experience and the culture of government, putting Ontarians at the centre, I think is very important. And we at Green Shield think it's very important, and have a lot of ideas actually about how we can help assist, particularly in the area of healthcare, to make sure that we're getting the right services to the right people at a cost-effective way. And I think we're quite lucky to have a minister like Mr. Bethlenfalvy to be taking leadership in this. He brings an incredible set of accomplishments from the private sector, and I think I speak for many of the businesses in the room here today that we look forward to partnering with you as you go down this journey. Thank you.
Just gave Cam the Corona handshake. So it is an honor to be here, and good afternoon, everyone. Given the circumstances, I'd like first off to thank the Economic Club for hosting me and my colleagues, and Natasha and Cam for that very kind introduction. I also want to acknowledge some of my great colleagues who are here in the room. First off, the Minister of Economic Development, Job Creation and Trade, Minister Vic Fedeli. He's the guy with the yellow tie. You can't miss him. The Minister of Finance, Rod Phillips, who is releasing our government's second budget and his first on March 25th. Minister of Finance, Rod Phillips. So thank you for joining us. Unfortunately, the Premier had to head back to Toronto to continue to deal with the rapidly evolving situation, and the rapidly evolving situation includes the Minister of Energy, Northern Development, Mines and Indigenous Affairs, Greg Rickford, who is here from the great riding of Kenora Rainy River, or Rainy River Kenora. I think it's Kenora Rainy River. So thank you for being here, Greg. Some of you may not know this yet, but the Council of the Federation meeting tomorrow has been cancelled. The Premiers instead will be speaking by phone. And unfortunately, and you may know this already, we have received news that the Prime Minister and his wife are self-isolating due to COVID-19. So our thoughts are with them, and we wish them a speedy recovery. Now, Team Ontario is still here and have been meeting with our federal counterparts on this, including Minister Christine Elliott, who is meeting with her counterpart this morning, and our Deputy Premier. She too had to go back to deal with the situation. We want to make sure that in our conversations with our counterparts, and I met with my counterpart this morning, the Treasury Board President Jean-Yves Duclos, to talk about, among other things, COVID-19, but also talk about the real needs for Ontarians in terms of infrastructure and health care. And I communicated that we really need the federal government to step up in these areas. And I think we're having good constructive talks, and our message is getting across. You know, I'm always happy to be here in Ottawa. I was here in Ottawa on Monday to do a roundtable. It's one of the few places that I can come to, and when I say I'm president of the Treasury Board, that people actually know what that means. Today I'm going to explain how our actions will change the culture of government while improving the lives of Ontarians. But first I would like to make a few comments about COVID-19. You know, we are at a critical time in this province, and Ontario is facing significant challenges. And as we know, COVID-19 has emerged as a global pandemic. And I can tell you that all levels of government, be they municipal, provincial, and federal, are working together to address it. We have a plan, we are prepared, and we are being prudent. And that is why Ontario has struck a new command table that reports directly to the Minister of Health and Deputy Premier Christine Elliott, and along with our Premier, are demonstrating extraordinary leadership. It's a single point of oversight that is providing executive leadership and strategic decision direction to guide Ontario's response to COVID-19. And that includes, which we recently announced, enhanced access to screening, enhanced lab testing capacity, and implementing new initiatives that will keep the public and the frontline workers safe. We are also immediately establishing a number of assessment centers in areas experiencing a significant growth in testing to ensure that we have the most up-to-date information which is proven to help combat the virus. Our province is also enabling doctors to conduct more assessments over the phone rather than the clinic. This will keep patients at home rather than in primary care settings where they might commingle with others. And in the coming days, the province is launching a new COVID-19 self-assessment online tool, and we are working closely with Telehealth Ontario to ensure it has adequate support to handle the increased call volumes. And we are committed to allocating additional resources as needed. Now, as the Treasury Board Secretariat and as President of the Treasury Board, I'm the employer to over 60,000 dedicated public servants, and I remain actively engaged with the Ministry of Health and other partner ministries to ensure the health and safety of Ontario public sector employees, the OPS. Because their and all Ontarians, our number one priority is the health and safety of all Ontarians and all our workers. It's important that as this public health situation evolves, the government, in its role as employer, consider additional steps to reduce exposure to the transmission of COVID-19. And one of these steps is ensuring that essential business-critical out-of-province and or international travel adheres to the federal travel health notices. Another is providing the tools and resources to support OPS, the Ontario Public Sector, employees to work remotely as appropriate. And finally, appropriate cleaning opportunities continues to be undertaken to reduce risk to staff and visitors within OPS-occupied buildings. So let me tell you, we are listening to the public health advice. We are listening to the officials on the science and the evidence. Our Chief Medical Officer, Dr. David Williams, is doing an extraordinary job, and it's all with the goal to keep everyone safe. And we will continue to update the people of Ontario as frequently and for as long as necessary. I have complete confidence that my colleague Christine Elliott, along with all of my colleagues, and speaking of the devil, Mr. Christine Elliott, Deputy Premier of Ontario. And I do want to emphasize again the outstanding leadership that the Deputy Premier and Minister of Health, Christine Elliott, is showing in these challenging times. She, as I mentioned earlier, is heading the command table and dealing with the rapidly evolving situation. So thank you for your work again, Christine, on that. I do also want to thank the frontline workers across the province, our healthcare workers and the many first responders and others who are so key to keeping our citizens safe. So a big shout out to them. And as the Minister of Health has assured all Ontarians, we will continue to take all appropriate measures to keep them safe and to keep all Ontarians safe, including our awareness campaigns and re-emphasizing how important it is to wash your hands, which my mother taught me to do. So I think I've learned that, but it's never bad to remember what your mother told you. But we have other challenges beyond that, and I'm here today to talk a little bit of some of them. It's in part of the burden that we inherited from the previous government, and that is with regard to our provincial debt. Our sovereign subnational debt load is the largest in the world. And both our provincial debt and deficit are diverting resources that could be used elsewhere. So in the previous 15 years, the debt was doubled. And I'm going to challenge everyone to think, what did we get for that doubling of debt? Le fardeau dont nous avons hérité du gouvernement précédent n'est pas négligeable. Notre dette provinciale représente encore le niveau d'endettement infranational le plus important au monde. De plus, dans notre dette provinciale que le déficit détourne des ressources qui pourraient être utilisées ailleurs. La question que se pose est la suivante. Que vous a apporté cette dette? So we've inherited, in many ways, a hallway healthcare issue. We've inherited gridlock. We've inherited higher hydro rates, and we need to take action. Did you know that every second interest costs $400? That means every month we are spending $1 billion. And it's in times like that we pay to our creditors. It's in times like these that we have to remember that fiscal responsibility matters. We have to make sure that we are sustainable for the long term. But the good news is we have a plan, and that plan is working. And through discipline and perseverance, and together with the Minister of Finance, Rod Phillips, and his stewardship, the $15 billion deficit has been brought down to $9 billion as of 2019. And why does that matter? Well, I think it matters because of times like these that we're involved with. You have to have the fiscal capacity to deal with unexpected shocks, whether they be a recession or, in this case, a pandemic. Now, the good news is last week the Parliamentary Budget Officer, who does a report on the long-term sustainability of province's fiscal situation, the sustainability of being able to afford health care and social programs and the like, for the first time since he's begun that report, has said that Ontario is on a fiscal sustainable path over the long term. Secondly, yesterday, the Independent Financial Accountability Officer, our version of the Parliamentary Budget Officer in Ontario, said virtually the same thing. For the first time in quite some time, Ontario is on a fiscally sustainable path. And ladies and gentlemen, this is very important because it is times like this that we need to have the firepower to be able to do whatever it takes to make sure that the health and safety on Ontarians comes first. I'm very proud of our government, who yesterday announced that we've included another $100 million in our contingency fund to combat COVID-19. And the Minister of Finance will be in his budget on March 25th talking more about the prudence that we've built into our budget. And we'll continue to monitor the situation, and we'll take the appropriate actions as the evidence and the science and our experts advise us to do. I got involved in government to do politics a little bit differently. We've got problems to solve. We know the solutions won't be easy, and that is why we're changing the culture of government for now and for the future, thoughtfully, carefully, and with tremendous care. Under the leadership of Doug Ford and our team, we are doing just that. So one example of that is last year we launched the Lean Delivery and Continuous Improvement Office to find efficiencies, reduce red tape, and remove redundancies across the public sector. You know, user experience and identifying waste are at the core of the Lean Delivery program. And the Premier and I and our colleagues are huge fans of this, of the Lean program, and we're seeing results. In late 2019, working with Service Ontario to apply these methods to accessible parking, the back office productivity increased by over 20%, meaning 300 more Ontarians were getting their permits sooner every day. So through Lean, we're getting better value for Ontario's taxpayer dollars while strengthening frontline services. But this all starts by putting Ontarians first. You can't be for the people unless you remember that across every service, every transaction, we must be committed to putting the citizens' needs first, with services delivered digitally, on your phone, in the palm of your hand, when you want it, where you want it. And ladies and gentlemen, there is no time to lose. It's time to embrace technology to make life easier while protecting jobs and creating new ones. It's time to embrace accountability when it comes to the standards of user experience and the way government operates. It's about making it work better, deliver what you want, when you want, and how you want it. Le moment est venu d'accueillir à bras ouverts la technologie visant à rendre la vie plus facile tout en protégeant des emplois et en créant des nouveaux. Le moment est venu d'instaurer l'obligation de rendre des comptes en ce qui concerne les normes relatives à l'expérience utilisateur et la façon dont le gouvernement fonctionne. Il s'agit de faire en sorte que les choses fonctionnent mieux, que nous vous fournissons ce que vous voulez, quand et comment vous le voulez. Shortly after our government was elected, we commissioned EY Canada to conduct a line-by-line review across the whole of government to see what was really going on. Tackling those issues became the basis for our plan for smarter government. And this is being implemented through our smarter initiatives. And let me tell you about some of the progress we're making here. I'll start with what we're calling Digital First. Under the leadership of Minister Elliott, we're putting digital access at the forefront of healthcare. That means creating a 21st century healthcare system that will connect Ontarians. More modern, convenient, and digitally enabled healthcare choices like home care visits and direct to patients, or online appointment bookings, and these changes will better support healthcare delivery, including the ability to connect remote communities to new and expanded core options. We're also improving our most popular online, and maybe I would just say, in the environment that we're in, where it makes a lot more sense to be online and to be digital because we want people to stay away and not be connected. Digital actually assists in helping achieve that and lowers the risk of COVID-19 spreading. So we have a plan. The minister is executing that plan, and we're going to get that job done where all of healthcare will be part of the 21st century in healthcare. We're also improving our most popular transactions online at Service Ontario and making more commonly used services available online. Services like renewing your healthcare card or your driver's license so that you can do it quickly, error-free, and with ease. And I can speak from experience because I was just in a branch to do my renewals. And for those who want to do it in a branch or at Service Ontario, that option will continue to exist. But a lot of people want to do things on their phone, when they want to do it, how they want to do it. And so we're enabling that technology to be doing that, putting the citizen at the core of everything we do. Because we know that doing every transaction online means that there's one less person in line. And these changes are happening now. We're also tackling purchasing. May not be front-page news, but centralized procurement. The government spends approximately $29 billion every year to buy goods and services from thousands of providers. And yet every week, I'm sure many of you, like my family, goes to Costco or some other place and buys in bulk to save money. So we say, why can't government do the same thing? From pencils to pacemakers, a modern and fully integrated procurement system will help drive savings of an estimated $1 billion a year. And this isn't difficult to do. We can do this. For example, the Ontario Public Service is on track to save an estimated $80 million over a decade by pooling mobile phone purchases across ministries. Simple, and it saves the money taxpayers money, and we can reinvest it in things like digital health care and education and social services. But it also allows us to foster innovation and by creating new points of access to government procurement for businesses, small and large. So through these changes, we're opening up the procurement process by placing all contracts online and at the same location. A smarter, simpler, seamless supply chain in Ontario will have a profound impact on people's lives. And let me tell you what this means for patients. Say, for example, a woman named Natasha just happens to be from Kenora, just like Minister Rickford. Natasha was injured in a car accident there. Her patient journey included an ambulance, a trip followed by a trip and admittance to a hospital, then transferred to a specialist before eventually being transferred home. But at each step of the way, medical staff needed to remove Natasha's IV and insert a different one into her veins. because every stop had a different IV supplier which used different needles. Imagine that. A patient already in distress needs to go through the discomfort of multiple needle insertions just because of an inconsistency in public sector procurement. We can do better than that for the people of Ontario. We need to do better. We're breaking down silos and creating a more streamlined and collaborative supply chain system that maximizes taxpayer dollars and encourages innovation. But let me talk about one other thing before I wrap up. Since it's March, I'll note one of my favorite examples of how we're already creating change. As you probably know, for decades, and you folks are here in Ottawa, for decades, government ministries practiced wasteful spending at the end of the fiscal year. It's often referred to as March Madness. It's not the basketball tournament. It's how governments spend money. And that's not unique as well in Queen's Park. We've all read the stories of how that goes. It's unacceptable, and that's why last year we took action. By limiting the seasonal discretionary spending, we realized savings in excess of $153 million just last year alone. And we're building on that success. We've again directed ministries to limit end-of-year spending to the necessities. And I'm happy to announce today that this year we've gone further. We've embedded this culture of financial responsibility earlier in the fiscal cycle, so we're getting smarter, so that March Madness in 2020 and moving forward doesn't turn into free-for-all February. Through the force of a special Treasury Board minute, in December I directed my Cabinet colleagues to not enter into any new funding commitments and limit spending to commitments up to March 31st. Spending beyond these activities, including spending from within ministry allocations, must have prior approval from Treasury Board for the entire fiscal final quarter. And this action speaks directly to the idea if we change the culture of government, we can change the way the government works for you and better for the people. That's also why I recently announced the creation of the Office of the Comptroller General and formalized a government-wide approach to risk management. For those of you who spend time in the private sector, this sounds familiar. That's on purpose. We're bringing the rigor of business to the business of government. And we think about building smarter government. We also think about how our plan will unfold into the future. So digital technologies such as artificial intelligence and deep machine learning have huge potential to improve government operations and decision-making. That is why, in 2019, our government formalized the role of the Chief Digital and Data Officer to assist with data management and tools across the Government of Ontario. These measures will enable using our large data sets to uncover gaps in delivery and quality of services, and then fine-tune and fix those gaps. For example, our Comptroller General will identify and help mitigate potential financial and policy risks before they begin. Now imagine if, as part of this new office, we could use machine learning to assess risks and detect anomalies, restoring confidence that taxpayer money is being spent where it needs to be. And this work is already beginning. Again, the Ministry of Health, picking on you today, Christine, but this is all good stuff. The Ministry of Health is engaged in a pilot project with the Vector Institute to use machine learning to analyze drug claim data. This will enable our government's ability to tackle and reduce fraudulent activities across the broader healthcare system. So, ladies and gentlemen, our government promised to do things differently, to get out of short-term thinking and to get into long-term thinking. Our plan has led to higher revenues and stronger investments in Ontario. Notre gouvernement a promis de faire des choses différemment. Cesser de penser à court terme et adapter plutôt nos réflexions à long terme. Notre plan a entraîné des revenus plus élevés et un investissement plus solide en Ontario. Our government respects taxpayer dollars because it is central to restoring trust and accountability to the province's finances, whether it's by cancelling redundant landlines to save tens of thousands of dollars. Yes, we had landlines at Queen's Park. No one in my staff knew what they were, but they're mainly under 40 years old, so they didn't grow up with them. Or consolidating supply chains to save $1 billion. The pennies and the billions all matter. Building smarter government is not possible unless we do it together. One of the things I've learned in this role is that you can't do it alone. government, academia, the private sector. None has all the answers, but together we can collaborate to solve problems. That collaboration confronts the short-term thinking that both the private and public sectors sometimes suffer from. Short-term thinking like, and I spent 30 years in the private sector, how do we beat the next quarter's earnings? You need a long-term plan, which you need to get working together collaboratively to deliver that long-term plan. And you need a vision. So through smart initiatives, Premier Doug Ford and all of us are working hard to make a real difference in the lives of Ontario. That's why I'm so excited every day to get up and get this plan done. Together we are changing the culture of government, making it work better, deliver what you want, when you want, and how you want it. But this is only the beginning. Smarter government is helping change the lives of the people of Ontario for the better, and thank you. And now I think I'm going to take a few fastballs from Rachel Curran at the comfy chair.
So thank you, Minister, for that excellent speech. I'm not Vashi Kapelos. I don't have her stellar interview skills. But I was making notes madly during your speech. I'm so glad to hear that Ontario's finances are finally on a sustainable path again after so long. As you say, it's exactly what we need to respond to an event like this. But look, this is a big one. You know, you spent decades in banking. You know about external shocks. COVID-19 is absolutely going to be one. Is your government prepared to respond?
Yes. And look, folks, we're going to get through this, and we're going to get through this together. The Premier was very clear about that this morning at our press conference, when we're going to do it together. But you make a good point, Rachel, that a fiscal responsibility, there's a reason that you want to be fiscally responsible, particularly in the good times, because you don't know what's around the corner. And that risk management, the Controller General that I talked about, we're going to embed a culture of risk management so that we can, what does that mean? That means that you can get data from multiple ministries and be able to move quickly. The Premier made it clear. We're going to do what it takes. We now have the fiscal capacity through the prudent measures that our government took immediately upon gaining office. And, as I said in my remarks, that's very encouraging that the Parliamentary Budget Officer, an independent party, has that view, or the Financial Accountability Officer, another independent, says we're on the right track. Doesn't mean there's a lot more to do, but I can tell you, along with the Minister of Finance, we're the numbers people that we have our hands on the fiscal situation. We are going to support what it takes. Yesterday, the Premier announced $100 million extra through a contingency fund to combat the situation. We build prudence into the budget. We'll continue to do that. The federal government, and I have to applaud the federal government for stepping up with $1 billion, half of which will go to the provinces. Roughly 40% of that will go to Ontario. That's another $200 million. So when I say, yes, we will get through this, we'll do it together. That includes all the people of this great country and multiple levels of government.
Thank you. And I appreciate your shout out to healthcare workers, too, because they're going to be on the front lines of this for the next few months. Can you talk a little bit, look, I know from experience, I know getting finances back into decent shape is a really difficult job, involves a lot of hard, very diligent work. Can you talk a little bit about what that process was like for you?
Yes, it's a great question. Again, I said in my remarks, you can't do it alone. You do it with your partners. You work closely with the Minister of Finance. So we've got two Ministers of Finance here, Vic Fideli and Rod Phillips, outstanding individuals with the involvement of the Premier and all your cabinet colleagues. You do it together, and you have to make tough choices. One example is the infrastructure fund. We've, along with the federal government, have the Investing in Canadian Infrastructure Plan. We've recently opened up the culture and recreation and community stream, and we got $11 billion of requests, and we have $1 billion to spend. So you got to make choices. You got to prioritize. That's what governing is. And you do that in part, not only working with your colleagues, but talking to your stakeholders, talking to the people, putting citizens at the center. That's a big part of what I'm trying to say here. In the private sector, for a long time, we built products and then pushed them out. And we started to figure out, no, maybe we should build something that the customer actually wants and build the product and systems and delivery around the customer to make it simple and easy. And by the way, making something really simple and easy is really difficult behind the curtain. When you've got thousands of legacy and systems in government and so on. But it's the right focus. So that's number one. Make sure you talk to people. Make sure you get their input, listen to the stakeholders, and communicate. That's another big part of success.
So on that front, how do you create public support for that kind of restraint or responsibility in an environment where it seems like, out of control government spending, or at least unrestrained government spending, is pretty popular?
Yes, fair question. I learned, I was co-president of Dominion Bond Rating Service, a credit rating agency, for a number of years. And, my teams rated governments around the world and banks. And when you downgrade a credit rating of a bank, and by the way, my team downgraded the credit rating of Ontario in 2009 because we saw a lot of other provinces take fiscal prudence into their budgets. Ontario was an outlier, and I can tell you that Quebec, for example, has had surpluses for the last 5 years. British Columbia even longer. We've got a plan to balance in 2023. So when you downgrade a credit, you always want to listen and make sure you got all your facts straight. You want to listen to stakeholders. You want to find out, listen. I think that's a hallmark of, we won't get it perfect, but you want to get that input. And so we've been very robust in making sure we have outreach. Again, citizens, stakeholders.
Okay, that makes sense. So just to your comments about changing the culture of government, I know it's very difficult to change the culture from the top down. It's not something you can impose. How are you doing this from the bottom up?
It's a great question. I'll give you an example to frame what you're really driving at. So something as exciting as compliance harmonization. We had a presentation, 19 ministries do inspection. So, and they have their own governance model, and they will be a health inspector or an environmental inspector or a labor inspector, on and on. And we may treat Rachel Curran and Company as one, you're one business, but if you're being inspected by 10 different ministries who really, they have purpose,
Right.
They treat you as 10 different companies. And so we're engaging on collaborating across ministries, which we can do through the force of Treasury Board and our ability to have a whole of government lens to come up with strategies and a vision to really, whether it's data management, just making sure we know who you are and when the last time labor or environment or health or someone, and then be able to risk manage that because we want to go after the bad actors. We don't want to waste time on the good actors.
Right.
And so the collaboration at the ministry level, they're very excited. The public sector is they're great people. We've got talented people in the Ontario Public Service. How do you work together? They want this change.
Right. This all sounds like common sense stuff that should have been done long before now. I'm glad you're finally on it. Why are you so passionate about smarter government or leaner government? Like, what's driving you here?
Well, part of it is, I'm the son of two refugees from World War II, and they met in this country and got married and brought up me, and I think this is a great country. But you've got to keep reinvesting in that, and you do that by, I think, I worry about the fiscal situation, so that's in part why I got involved and help make Ontarians' lives better. And the taxpayer's credit card's not unlimited. And we have this great opportunity in this province, this country. We've got some of the brightest people coming out of academia. We've got a world-class academic system. We've got a private sector that's very engaged in technology and a public sector that's willing to work collaboratively. And we have an opportunity in this country because we are smaller to work together. So I think this is a real opportunity to get taxpayer value for money, do things smarter, and think more like a business to say, okay, it's the citizen at the end of the telescope here. It's not the government that we're doing these for.
So of all of these citizen-centered initiatives, smarter government initiatives, is there one that's your favorite?
Well, I do love the digital first. I think we're going to digitize everything you can. I've got my riding's Pickering Uxbridge, and up in Uxbridge there's a small hospital, and they have a room for virtual checkups, or if they need to see a specialist, they can be hooked up there and have that visit done remotely in that hospital, and they love it. You know, and there's, because they don't have to drive downtown. For those who want to drive downtown, fight the traffic, the gridlock, and pay the parking fees, and take your full day to get there, knock yourself out. But many really love the experience of being able to do it when they, much more conveniently. And the flip side of that is the cost to do that is much lower for the taxpayer. So it's a win-win.
Right.
So I think digital and smartphones have taken over our day-to-day lives, and there's no reason why government can't do the same thing.
Yeah, absolutely agree. Now, part of the problem with governments and politicians is that they think in 4-year cycles at most, because that's when they're up for re-election again. How do you work around that? How do you plan for the longer term if you've got to be into an election, I guess now 3 years?
Yeah. Thanks for that question.
Sorry. No pressure.
I'm a bit of an anomaly. I mean, I've always thought that you really create value through long-term thinking. If you subject to short-termism, as we call it in the private sector, and just think short-term, you can't really create value for citizens or for your customers. So I think that we've come up with a plan. Yes, it's a longer-term plan. It's being put in place. But just stick to that plan, and hopefully that the electorate will reward you, that you've got the plan, you're making progress. I don't think many people are expecting us to fix hallway medicine overnight. But we have a plan, a very detailed plan on how to get there by dealing with the long-term care situation, not enough long-term care beds, by dealing with mental health and addiction, by putting more money in supports for more preventative type medicine, physically and mentally, by doing it, organizing around communities, the Ontario health teams, and doing community and home care, thinking outside the box of how to deliver effective health care differently than we have in the past, that actually services the needs of the individuals and the patients. I think by that sort of thinking, having a plan and sticking to that plan, we'll get rewarded because we'll have a lot more to do.
I hope that's true. I'm obviously biased, but I hope you're absolutely right about that. Minister, thank you so much for taking the time to chat. I'm going to ask Pamela Frolick, who is president of Innovative Medicines Canada, to come up and say a few concluding words.
And thank you for subbing in, Rachel.
Thank you. You're welcome.
We're a bit over time. My comments will be very brief, but I do want to thank Minister Bethlenfalvy for his words, pour vos mots d'inspiration et d'espoir. It's very hopeful, the messaging that you have provided on all fronts. I'd also like to extend Cam's words earlier. You thanked the public servants, the ministers who are here for the work they're doing and the leadership. I suspect that everyone in this room has a leadership role to play in this chaotic, unprecedented world that we're working in. So my thanks and congratulations to all of you as we struggle to find the best way forward. The comment about your presentation, Minister, is it warms the cockles of my heart and probably those of many others in this room. The issues that you spoke of in terms of reducing red tape, of using big data, obviously improving health care for the 21st century, procurement, the power of bulk purchasing, which is already happening in the industry that I represent, pharmaceuticals, and it's a benefit to everyone. Cross-departmental functioning, what a novel concept. We love that. So thank you so much for that, and obviously the other C word today, collaboration. I would like to ask everyone let me put it this way. I'm guessing that everyone in this room, coming back to the theme of COVID-19, is desperately waiting for that vaccine to be discovered. Wouldn't we love to be able to rush out, get that vaccine, release our breath, take deep breaths, know that we'll be protected? And it isn't there. That is, however, the way patients in this country feel day in and day out when they can't get the medicines that they need. So for once, we're really, I think, experiencing a world that my members, the pharmaceutical industry here in Canada and abroad, the patient groups, we work in this every day. So here we are, all of us, experiencing this dramatic time in our lives of knowing what it feels like to have a desperate need for a drug that we can't get. So I underline that. Many of you in this room know me and know I represent an industry that lives and breathes producing those life-saving and transforming medicines. I can tell you, I have my phone here because a few minutes ago I received a copy of a press release, thank you, Bobby, from one of our companies, Medicago, based in Quebec City, that has just identified a viable vaccine candidate. They expect to be doing preclinical trials in 4 weeks, have human trials a month or two after that. So we're on the track. We do want to keep that access going. Through all the initiatives you said, cutting the red tape, we're in a fight for our lives, patients and industry alike, against some regulatory changes that are not going to improve that situation. Let's hope that this vaccine doesn't get caught up in those regulations, because if implemented as proposed, we'll all be in trouble. So let's end on the optimistic note of collaboration, where we work together with the governments at all levels and industry, patient groups. That's where we will get the best solutions together. So thank you again for your inspiring words and giving us the hope that this will in fact happen. I wish everyone a safe and happy and healthy rest of your day and week. Thank you, Minister.
Thank you.